All right. Hi, everyone. I just wanted to welcome our guests here today. We're going to be talking to two very important people from the Harford County Department of Health, and they're going to be talking to us today because of Pride Month. It is June, so we're here to celebrate our friends in the LGBTQ plus community and to also know that we have resources for you that are at the health department. And so we're going to be talking to them. I'd like to give them the opportunity to introduce themselves. So Zach, Tiffany.
Yeah.
Thank you.
So my name is Zach Kosinski. I'm the Harm Reduction Program Coordinator at the Harford County Health Department. Tiff, you want to introduce yourself, and then I can kind of like detail all the stuff that falls under us?
Sure. So my name is Tiffany Cox. I work with the Health Services and Harm Reduction programs. I'm the administrative aide for both of those programs, as well as a certified health worker. I do a lot of our outreach work for testing and counseling for HIV and Hep C prevention. We do a lot of that in the community, and one of those locations is at Harford Community College.
Yep. And so other stuff under our harm reduction unit, other than what Tiff specifically just detailed, our STI clinic, sexually transmitted infections, our PrEP, pre-exposure prophylaxis for HIV prevention program. We have a hepatitis C treatment program, all of the testing things Tiff listed, lots of sexual and drug user health education. We have our naloxone or Narcan distribution, fentanyl test strip distribution, and our work on trying to develop a harm reduction informed syringe services program in the county. So our unit really addresses specifically sexual and drug user health, and then any and all groups of people that kind of falls under, so we cater to.
Wow, that's really a lot of information and a lot of support that you can offer our community. So anyone that's watching this, if you check out below, I'm going to have links to all of those different resources that you can just tap into to get some more information. Otherwise, we're going to cover a lot of really cool stuff today that is going to be very supportive for our community. So great. Let's get started on some really good questions that we have here. So tell us a little bit specifically about what you do at the health department for the LGBTQ plus community.
So one of the biggest things that we do participate in is the Pride event in Havre de Grace that prior to COVID-19 was a new and a big deal for our community. And but in all of our programs, all of those things that Zach listed, they are all very welcoming and encompassing for, any and all folks. We have a very, very open and wonderful group of people that just, we really want to meet people where they're at. So depending on, it does not depend on what your needs are. We are there to really help you and guide you to where you need to be.
Okay, so I guess what are some strategies that you use to create and promote the positive and healthy outcomes for people?
So we do, as said, when we go and do our outreach, we do a lot of programs where we can go out to the community and want to really, again, meet people where they're at, making sure that they're in a comfortable space, they can ask questions. We do a lot of sex and health education. So that way, folks know that there is a place that they can go to have those questions asked.
So for that, some people might not be comfortable necessarily coming to you or you coming to their house. Do you do anything, especially during COVID, that's like telehealth, things like that?
So we do, yep. We do have a telehealth program. So especially with our PrEP program, we have been able to offer telehealth appointments so that folks are not missing any opportunities to engage in treatment, engage in care. And it's been really awesome. I know a lot of our folks have loved the ability to just be able to hop on their phone and have that space in their home where they know that there's nobody around, nobody's, listening in on their conversation. And again, we always make sure when we're setting these appointments, like, hey folks, make sure you're in a space where it's, confidential, you're comfortable, and then you're one-on-one with your provider. So there's a lot of that engagement, in a time where, where we're used to the face-to-face, that they're still not missing out on those opportunities.
Great. So it sounds like you do make a really welcoming space, whether it's in your office or on our campus or on the phone. How do you also make it more inclusive for people in the LGBTQ plus community so that when they're talking with representatives from your office, they feel safe and comfortable?
I could speak a little bit to that first. We do a good deal of training for our staff, whether it's, I mean, not just within our programs, but also externally for the health department overall. So that means that not only are the people within our programs that are directly providing services, it's, you know, if you're a PrEP patient, it's the nurse that you're talking to when you come in, it's the provider that's prescribing your medication and ordering your test results or your tests. It's the community health worker and the PrEP navigators that are reaching out to you in between your appointments. It's the staff at the front desk who are calling to confirm your appointment time and who are greeting you when you come in person. It's our administrators who are, you know, doing our budgets and our funding for the programs and all that. So we provide a good bit of, we call it LGBTQ cultural competency. Older times we might have called it like sensitivity training, but we really think of it as cultural competency training of how can we make sure that we are, and all of our staff are best informed and ready and able to support people who come into our clinic. Whatever your background is, whether that's your racial, ethnic background, if you have a disability, mental health concern, substance use, not heterosexual, you're not cisgender, whatever your sexual orientation or gender identity is. Wherever you fall on any spectrum of identity, we do our best to train our staff to be best prepared to support people. Sort of like, I think y'all maybe might be familiar with safe space or safe zone style trainings that happen on college campuses sometimes. We strive to replicate that internally at the health department. Another big piece of it is we do have some staff, we intentionally try to bring people onto our team who identify as members of the communities we're serving. And so I identify as a gay man. I also identify as a person in long-term recovery from substance use. And so we try to bring people on that have like real world personal life experience connection to the folks that we're trying to serve, so that, I mean, I can speak one-to-one a little bit better with another LGBTQ person because we have some shared experiences.
Wow, that's great. And that actually, you talked about a lot of things that are almost, they're very stigmatizing sometimes in the community as a whole. So I know if you had anything you wanted to touch on dealing with the stigma around maybe getting tested. And I don't know if a lot of our viewers are familiar with the PrEP program, but if you wanted to talk a little bit about that and maybe how you're working to either destigmatize that or address the stigma in the community as a whole.
So that is one of the things we definitely had on our list to talk about. So like you said, Laura, there's a lot of stigma around testing and PrEP, and it's a lot of it is just the fear of the unknown. So as a outreach testing and counselor, one of my biggest goals is, you know, I always start every conversation with, you know, this is no judgment zone. I'm here to help you, and I'm here to give you any information that you want, and letting people know, giving them the opportunity to speak to me, and that way I'm not speaking at them of what they should be doing. And I think one of the biggest keys is listening to them and what their needs are. Everybody should be tested. Everybody should know their status. But a lot of it is in our LGBTQ plus community, there's a lot of fear because there's so many other factors that, you know, they have all these, you know, balls are juggling in the air at one time. So really, again, trying to just meet them where they're at and answer their questions in a respectful and an honest manner, so that way they can feel comfortable of getting this test. And getting a test is not a bad thing. Getting a test is really, you know, for the health of you know, the overall person.
Before I forget, I just wanted to note, like, real quick, I know we probably will talk a little bit about family and stuff like that with LGBTQ youth in a bit, but I wanted to touch on confidentiality and some concerns that sometimes younger LGBT people have with getting tested or accessing PrEP. So HIV testing in the state of Maryland is protected. So if you are under the age of 18, you can actually consent to an HIV test. There's no paper trail or record that will go to a parent, right? We can provide that for free, not have it billed to insurance, those sorts of things. Another concern is sometimes with like probably more traditional age college students, like 18, 24 in that age range. A lot of people are still on parent or guardian's health insurance. And so people are rightly concerned, like, well, if I'm not out and I'm getting on PrEP because I'm concerned about HIV and I use my insurance and the bill goes home, are my parents who I'm not out to going to see it? And that's a concern we've dealt with patients before, and we can help navigate that on a case-by-case basis. We'll help work with you, the insurance company, to figure out what exactly, what information does go back that parents or guardians, the primary policy holder of the insurance, will be able to see, to make sure nobody's getting outed based upon the fact that they're seeking care to take care of themselves. And if it ends up being a super big concern with insurance and they're like, no, we definitely send an explanation of what this is to the policyholder, we have lots of ways in place to help people get the medication and their office visits and lab work and all that stuff paid for, so that there's no billing to insurance necessary.
That's really great information. Thank you so much for sharing that. I think that could be a huge concern for a lot of students, especially, like you said, under their parents' insurance. They need to do things in their own time. So that's great to know. And you talked about different tests and things like that with insurance. Can you talk about a little, some of your testing services that you do offer in the area?
Absolutely. So the biggest thing that we offer is a 20-minute rapid test. It's a quick finger stick. And again, it's a free service that we offer at the health department, whether they come into the health department or we come to them, whether it's at the college or one of our other outreach events. And this is one of the best ways to kind of get started to knowing your status. It's free, it's confidential. And again, there's definitely no paperwork that goes to any type of parent or partner or anything like that. So the test is between you and the person who is administering the test, and that conversation, is protected, and it is definitely in a safe space. And anybody can be tested for HIV or Hep C. So again, it is just knowing your status. The other thing that we've done throughout this COVID-19 is we have initiated at-home tests. So we have at-home test kits that we can, if somebody shows up at the health department while we're still closed, we just have staff on site that can give them the HIV test kit. We also have codes. So if a person calls in and they are in immediate need of a test, we can email them this code, and then they'll get shipped out a test. And that creates, the continuity of the free and confidential.
Mm-hmm. It's a coupon code, essentially, where we can share this unique coupon code with somebody. They type it in on the website, put their address and all that sort of stuff, and they'll get mailed the test directly and discreetly.
Okay. So with the testing, you do HIV, STI, there's harm reduction, those kind of programs. So why are they most involved in supporting the LGBT community?
Yeah. So, and this, for me, when we talk about sexual health, we talk about drug user health, we're talking about stigma. We're talking about, for whatever reason, US culture, we have a whole lot of hangups about sex and drugs. And even though LGBTQ identity is not, does not boil down to just sex, because of the way that the community has been seen, especially in previous decades, sort of gets its specifically LGBT identity gets very, very tied to sex. The other connection we have is the HIV epidemic. When HIV hit in the late 80s and really, really impacted the US first among countries in the world, it devastated communities primarily of gay and bisexual men. And the entire broader LGBT community really rallied around and behind those who were affected, and sort of created a separate healthcare system. Actually, what happened. The system today of federally qualified health centers was actually sort of started as a system of health centers specifically for people living with HIV, for the community to take care of themselves. And because of that stigma that was experienced, what we find sometimes is that members of the community oftentimes make their way into lines of work that support people who continue to be stigmatized. And so when we talk about sex, anything open about sex, sexuality, as being like a stigmatized thing, like we don't want to talk about it, we don't want to do it, it's bad, et cetera, people of LGBTQ experience oftentimes gravitate into that line of work. because of having personal experiences of feeling stigmatized or marginalized themselves. And so it's like, well, I feel really, really comfortable talking about things that are super, super stigmatizing. And so there's this connection with stigmatization of LGBTQ people. And then because sex is stigmatized, sometimes the staff in our area tend to just be a little bit more well-equipped to be able to be supporting stigmatized folks. Same thing goes with drug use, harm reduction side of things, with our Narcan, fentanyl test strips, syringe services, training and education on those points. Drug use is stigmatized, and we know that people use drugs for all sorts of reasons. And a lot of times it's underlying untreated mental health conditions, it's trauma, it's stuff like that. And so we judge and stigmatize people based upon their drug use, when really we should be doing the same thing we do on the sexual health side of things, just wrapping people with love, information, and supporting them to make the best choices they can. So in our area, we do the same thing with our drug user health services. And so it's, for us, the uniting thing is sort of the anti-stigma, the being supportive, sharing love. That's sort of like our philosophy that runs through sexual health work, that runs through drug user health work. And it just means then that our unit and our programs there, we care an extra whole lot about LGBTQ and all other stigmatized, marginalized groups of people.
Well, I'm really happy to hear that. I'm sure everyone that's watching this is, because of everything that's going on in our country right now. I think we definitely need to talk about the intersections of race and gender identity and sexual orientation and ability. There's so many different things that can make a person feel very marginalized or not cared for in our country, especially healthcare. So maybe can we talk about a little bit more about how there are some barriers to healthcare for people that identify in different areas, and also how, I know you kind of talked about having peers in the health department, but along with those barriers, what are some ways people can cope and move forward through them?
Yeah, big questions, right? Big question. I mean, first I'll say, I'll name it very explicitly. Like right now, we're talking a lot about race and racism in this country. It's not that it's a new conversation. It's an old conversation. It seems to get reignited and have sort of spurts of when it's really, really on the public conscious right now. And I think it is. I want to name too that as a white person, I have the privilege of not having to think about having this conversation on a daily basis. And that definitely informs the way that I go about my life. And so I want to say, like, I'm speaking to this from a professional vantage points of how it impacts clients and our services and whatnot, but that I can't speak to actually having a personal experience with racism. So we've got, I mean, the race and ethnicity piece, and then we have LGBTQ identity, right? And one of them, I'd say we call it a visible identity. So race, ethnicity are visible because somebody walks in the room, we generally judge based upon their skin color, other physical characteristics. We kind of put them in a box and say, all right, this is your race box, white, black, Asian, Hispanic, whatever that box is. So race is a visible identity. Sexual orientation and gender identity are, we call them invisible identities, because it's, even if we attribute some personal characteristics like attire, masculinity, femininity, all that sort of stuff with it, in general, they are by definition invisible identities, because you can't just like look at a picture of somebody and necessarily in every case tell, like, you're gay, you're queer identified, you're a lesbian woman. So we have this visible identity and this invisible identity. But they're also not like two separate things. A person has both of these identities at one time. You have your sexual orientation, your race, you have your gender identity, and you can have any combination of the three of those things. You can be a straight lesbian of color, you know, you can be a gay white man who identifies as trans. So it's like it's a complex intersection there. And when you specifically have people will have like more than one of those parts of their identity is marginalized. So if you are a Black trans woman, for instance, the likelihood that you've experienced discrimination in healthcare goes through the roof. Being a trans woman, you're more likely to experience discrimination in healthcare. Being a person of color, you're more likely to experience, discrimination in healthcare. If you are a trans woman of color, call that, double marginalizations or intersections of identity there that makes it like even more overwhelmingly likely that you've had a bad experience. And so we do our best to make our staff aware of that. It doesn't mean we're perfect. Does not by any means mean we're perfect. We do a lot of training for our staff. We try to target our outreach materials to make sure that when we're putting language in our ads or something like that, that we are being inclusive and communicating to everybody that when we talk about PrEP is for you, regardless if you're a man, a woman, whether that's a cis or trans identified, wherever you identify on the gender spectrum, whatever your sexual orientation is, race and ethnicity should not be a part of whether or not PrEP makes sense for you. So we really try to communicate that if you're at risk for HIV, you're at risk for HIV, regardless what other your identity factors are. And we try to communicate that out in addition to the training we're providing for our staff so that when people walk through the door, we want to make sure that folks don't get treated differently based upon the way they look or how they identify. But it's, I don't know, again, I can't say that I've had the experience of having like these intersecting marginalizations of identity. And so in cases where inevitably we are, as all healthcare providers, imperfect, and we are gonna slip up sometimes. If we make a mistake, if a patient has a negative experience with us, we wanna hear about it. We wanna hear about it so we can do our best to say, we're sorry this happened, we made you feel that way. We're going to do what we can to improve and make it better. How can we help to address it right here and now? Because the last thing we want to do is for someone to have a negative experience and not come back to access the care that they need. We have PrEP here. We have HIV testing. We have hepatitis C treatment. We have all of these other fantastic services. And we do not want to push people out and away. If we're doing that inadvertently, we want to improve and we want to make sure that we can make it a more welcoming space for someone to come back to. Did that answer your question?
I think it did. Absolutely. There's a lot of really great information. And I can see that you all are trying your best to make people comfortable and giving them more than adequate resources and material that they need for their health. But on that same note, are there other organizations that you partner with or refer people to if they need any more specialized treatment or care or information?
I mean, so in terms of like the healthcare side, absolutely yes. If we're talking specifically like LGBTQ advocacy or community organizations, we don't have much of that in Harford County, which is unfortunate. We've been in conversation on an ongoing way with some of our patients about like, what do you want to see? How can we at the health department be supportive of something like this when it's not really in our wheelhouse to kind of put up a community center or something like that? I think in Harford County, we rely a lot on social networks of people. And so if we have someone comes in and says like, I identify as XYZ, and I'm feeling isolated or alone, we say, well, here's somebody we trust who we know also identifies that way or knows of other people who identify that way. You want to reach out to them and sort of like join a social network rather than sort of a formal organization. When it comes to other healthcare referrals, we have full referral lists of, say it's for someone who needs medication assisted treatment like Suboxone or methadone because they're struggling with opioid use. We have a list of all of the people who provide those services in the county. And then we have a second list that we keep in our head and our heart, which is the people that we know, the providers we've sent people to before who may be LGBTQ identified, who have had a positive experience there. And so if we have an LGBTQ patient who's in need of a specific service, we're not just going to pull from that whole list of providers. We're going to say, all right, we know providers A, B, and C do a fantastic job and are really, really great at supporting people in this community. Let's send those folks there for it. So try to kind of screen our referrals a bit to make sure it's a safe place for people to go.
Yeah, to piggyback on that, and again, I think we tailor it to the person that's sitting in front of us. So taking their specific needs into consideration and then feeling confident in sending them to a trusted source.
That's fantastic. I love that that specialized level of care, especially when it comes from the heart, like you were saying. Like you really value what your patients that are coming in are telling you about their different experiences, and people need that kind. They don't want to just be handed a list and say, you know, start at the top and work your way down until you find someone that works for you. You want to be like, hey, look, I know your situation, and these are the resources. So that's fantastic that you do that. But you also talked about a lot of the different resources that you all offer. Are there any costs associated with them so people walking through your door kind of know and have a handle of what to expect?
So yes, so like we kind of touched on before with PrEP, it is an insurance-based service. Now again, we don't let that become a barrier. We really, our team really fights to break down barriers and not let anything stop a person from engaging in treatment. So again, the HIV testing and counseling, the rapid tests are free, but the lab work and the medications that come along with PrEP definitely are an insurance-based program, as well as like Hep C treatment. And again, but now our Narcan is a free and confidential service that we also offer to the community.
Okay. And I guess with all the talk about insurance, the health department offers people like care coordinators or something like that, correct? If someone didn't have insurance and they needed help, you all could do that as well. Not you specifically, but the health department. You all already do too much.
Yeah. So where all of our programs we've talked about are located at our Edgewood office, and it's sort of our home base. We do a lot of outreach going places, and we have some of our services available 1 day a week in Bel Air. But for the most part, we're in Edgewood. We have at all times 2 insurance navigators located on site that are able to do enrollment in Maryland Medicaid, medical assistance. They can help a little bit for folks who might not qualify for Medicaid but want to sign up for a qualified health plan. The person has to do it themselves, but they can kind of help navigate that process. And all of our staff are well trained to be able to answer questions and help you navigate if you already are insured, whether it's private or public insurance. Going to like touching back a little bit on at least the PrEP and the Hep C piece. So our PrEP and Hep C patients, most of them pay nothing or a small copay for their visit when they come in and maybe their lab work. We're generally able for 95 to 99% of people that we get on PrEP here, they pay nothing for their medication or $1. In some cases, they'll pay $1 a month for their medication if you have MA. For the lab work and the office visit, those are the 2 other costs in addition to the medication. If for whatever reason they're out of what someone's able to pay, we have some stuff in place where we're able to help make that happen, whether it's through alternative ways to get your lab work done or it's actually help with payment assistance. We have some stuff available that costs will, and I don't say we try to make cost not a barrier. Cost is never a barrier. If it's a barrier for you, we'll take that on and we'll break that down to make sure that you can get access to it. And the same thing goes for hepatitis C treatment. And if we got to fight with your insurance company to get it covered for you, we'll fight with the insurance company. You don't have to worry about it.
Oh, well, that's great to know because, you know, our students, they vary in age. Like you said, we have a lot of non-traditional students, but we also have young people that are also in high school and they just, you know, either they're going to school full time or they're working full time and going to school full time or part time, whatever their situation is. A lot of times cost is a barrier when it comes to a lot of needed health care or just other things that they need to get out of the community, whether that's, you know, we in my office, in my job, I focus on a lot of food insecurity. And the last thing I want is for a student to have to decide between food and education or healthcare and their education. So having those barriers be able to be removed and you working with that is great. So I know that we're running out of time. So just for that, we've talked about so many good things. So I just want to thank you again for being here. And let's see, I know in talking with barriers, we've talked about a lot of different barriers, but for some people, family might be one of the biggest ones. And like you have said, you know, young people on their parents' health insurance, having them not out and worrying about that in that community. How do you think, how important is it to have family involvement in their healthcare and their lives specifically? But on that note, what are some suggestions that you would have for gaining the support of family members when a young person or anyone really isn't out yet to their family?
So again, there's not a lot of support groups or a lot like we mentioned earlier in Harford County. So we try to, if it's education that somebody needs, or if it's just, again, having that person to talk to, I think a lot of our young folks don't know what to say or how to say it. So again, it's just trying to encourage and help them with maybe the language or the things that they need to say. Family acceptance and support is huge, and we know that can create whether they're going to pursue, PrEP or getting tested or whatever it is, or it could completely block them. So I think it's trying to have those open and honest conversations with their family members, and then learning where the resources are, that if they do not have that support, knowing that they could come to us to at least have that free and confidential space to pursue the needs that they have.
Great. And so,
say the same. Sorry.
no, go ahead, Zach. What did you want to add?
To say, I'd echo that. I also add that we do have PFLAG of Upper Chesapeake, of Bel Air, Upper Chesapeake area that's heavily involved with Harford County Pride Festival, Upper Chesapeake Pride, that was put on last year and hopefully will be rescheduled for this year. They're a fantastic group. You want some, if someone doesn't, if it's important for someone to have family members, parents, guardians, especially specifically in their lives and supported of them as a member of the community, PFLAG could be a great place to find an adoptive parent, someone to talk to in that way. But I'd also say that we never expect it. I've definitely met people who say, you know what, I don't want family involvement, and I'm okay with them not knowing about the fact that I'm LGBTQ identified. Whereas some people, it's much more important. So we're going to roll with the punches of whatever somebody needs and make some recommendations based upon that. We do have patients that talk to us about that stuff. Like, we're healthcare providers, but we try to provide more. And if you're here for your visit and you're talking about some tough stuff going on in your life and feel like family's not there to support you for it, like, we'll find one of our health educators or outreach workers to sit with you and talk as long as you want.
Yeah, that's great. And I just want to clarify that PFLAG stands for, is it Parents and Friends of Lesbian and Gay?
Yes.
Okay.
Yes. It's an old name, not just about lesbians and gays, and it's not just for parents and friends. It's for anybody, everybody. It's much broader. It's a cool little acronym. It's been around.
Yeah, but it's a great place for allies that maybe are watching this to say, you know what, like, I am a friend or a family member of someone in the community, or maybe I think I am and they're not really sure, but they want to reach out and find some support and ways to talk to their loved ones, because sometimes, you know, maybe they aren't out and they just want to be supportive. So that's a good place to start. So I'll make sure to include that link below so that if anyone is interested.
Already organized sort of network of people. It's a place that not just allies can go. Members of the communities, if you're looking to connect as well, they can kind of help direct you.
Okay, that's awesome. Thank you for clarifying that. And I guess maybe that might wrap it up. I think we've talked about a lot of really important things, and it's a lot for people to digest that are watching this. And like I said, I do want to include all of the links to the resources that the health department offers and other supportive organizations that we talked about today. So is there anything else that you wanted to add?
Give us a call or pop in if you need anything.
Yep, we're here, and you're not alone.
Well, thanks again, Tiffany and Zach, for coming here today to talk to us about this and to celebrate Pride Month with HCC virtually. If anyone that's watching has any questions, please feel free to email Zach or Tiffany or myself. Our emails are down below, along with a lot of really helpful information and organizations in the community that you can be a part of. So hopefully we'll hear from you if you have any questions. Otherwise, enjoy the rest of your Pride Month and your day. Thank you.
Thank you.
Bye.
Bye-bye.